Critical surgeries for transplant patients are being delayed because of lack of those ICU beds. Scripps Healthcare says it's had to delay procedures. For example, NBC7's Melissa Don explains how San Diego hospitals are trying to handle this difficult decision-making process.
Often, people wait months or even years for critical surgeries like an organ transplant or removing a tumor, which is why a top surgeon at UC San Diego Health wants to ensure that COVID-19 cases drop before it impacts many more beyond the virus.
It's heartbreaking.
UC San Diego liver and kidney transplant surgeon Dr. Kristen McKeel has a warning for the community as ICU bed spaces get filled.
Really, it just comes down to a point where you can't do a transplant because there's actually no place to put the patient after the transplant. There is no ICU bed, physical bed available. And that's really the issue that we're getting into.
An issue that was already met last week at UC San Diego Health as they had to delay a liver transplant surgery. Luckily, this week they were able to perform several transplants.
We are really doing our best here to not have that happen, but it is within the realm of possibility.
Dr. McKeel explains how when ICU bed spaces fill up with COVID, trauma, and other emergencies, it puts a strain on organ transplants or removal of cancerous tumors. For transplant patients, they need to have a bed available, as post-surgery, it can require ICU care from anywhere from 24 hours to even several days.
The reality is, if we don't fix the public health problem first, the economy is never going to recover.
The severity inside our hospitals is concerning doctors, which is why some are disappointed in the San Diego judge's ruling allowing businesses to defy current public health orders. Dr. Lepe says there needs to be one consistent message.
It's very confusing and it's very distressing.
But I think all of us have to realize, not only for our transplant program, that if there is a COVID volume that gets so high that things like transplants and other cancer surgeries in particular are the other thing that's been really impacted at UCSD, won't be able to continue on.
A delay that could cost more than one would think. Melissa Don, NBC7.
Sharp and Palomar Healthcare tell NBC7 they are still doing critical surgeries, but delays might happen if things get worse.